Welcome to today's webinar with eLotus, the leading provider of acupuncture continuing education. My name is Donna Chow, your host and your moderator for today's webinar. Before we get started today, we have an exciting update on our website that comes after 3 years of dedicated work. Introducing the new addition to the core section at elotus.org, the LCH Auricular section. LCH is short for Dr. Li Chou Huang, who is a renowned auricular medicine doctor known for effectively treating conditions using just the ear. To explore this section, visit elotus.org and click Core at the top. There, you'll find the LCH Auricular section. Within it, you'll discover the overview, location, diagnosis, and treatment sections, along with nearly 200 auricular points listed alphabetically. Clicking on a point name will lead you to a photo and its description, indicating its location and application. This provides a great opportunity to start learning auricular diagnosis. If you hold a Gold Pass, you can access the VIP section for free, allowing you to advance in this protocol even faster. The link will be shared in the chat shortly. Happy exploring! Today's class, Channel-Based Acupuncture Strategies for Treating Pain, is presented by Mark Mastrandrea and is sponsored by Evergreen Herbs. The class will run from 8 a.m. to 5 p.m. Pacific time, and we'll be having 4 scheduled breaks, and lunch is going to be from 12 to 1 p.m. So before we get started, let's make sure we're all set up for an engaging and informative session. Everyone, please set your chat preference to everyone right now so that all attendees can see what you're typing and be part of the conversation and nothing goes missing. And if you have any questions for Mark, we do ask if you can please send them directly to him by using the Q&A box. Then after the webinar is over, you guys will have a quiz to earn your CEUs. I'll send you an email notification once that's ready, and it's usually no later than the following day in the evening. So our speaker today is Mark Mastrandrea, a graduate from the Swedish Institute with a background in Chinese medicine. He opened and ran the Pochi Lam Clinic, a high-volume clinic that employed multiple physicians of Chinese medicine, treating patients with various medical issues. In 2016, Mark moved to Beijing to further study Chinese language, culture, and Chinese medicine, including Bagua Zhang with Shu Shi Shi. In 2019, after studying with Shu Laosi since 2013, Mark became the final disciple of Shu Shi Shi for his lineage of Yin-style Bagua Zhang. He also worked at Guoyi Tang Hospital in Beijing, where he and his colleagues heard rumors of a new pneumonia surfacing in Wuhan in late 2019. Having taught exceptional courses on Wenbing diseases, divergent channels, and Shanhen Lin with us in the past, Mark's expertise is highly valued. For access to his previous video courses, please visit elotus.org. And now, without further ado, let's go ahead and welcome Mark Mastrandrea.
They don't see me yet, do they?
They don't see you yet, no.
No, cool.
Because they're where you are, so.
I gotta make sure my hair's right before they.
Okay, I'm
Does my hair look okay? I'm on. Good morning. Good morning. Good. Everything's good. Good morning, everybody. Just pulling this up here just so I can see your chats. It's nice to be back at eLotus. Thank you, Donna. Thank you, Tina, and everybody else for having me back. Today, we're going to talk about acupuncture strategies, particularly needling techniques that come out of the Ling Shu, Chapter 1 and Chapter 7, because they're really the basis for a lot of needling in acupuncture. And today, we tend to use the filiform needle, right, which is just this needle. Everybody gets them in packs, right? You get them in a pack, they're just a straight needle, but there's a lot of other needles that you can use. So we're going to go over some of these things because a lot of the techniques to that needling, people don't practice them anymore. and they make a big difference as far as what kind of reactions you get. What kind of reactions you get. I'm looking at the computer screen. You look at the camera. What kind of reactions you get with your patients. I'm also going to suggest to you the idea that the functions of the points aren't just because you needle them and intrinsically in the point itself. Some of those functions are developed because you needle the point a certain way. So there are these 9 basic needles that they talk about in the Ling Shu. And in those 9 needles, there's actually a series of principles or techniques that are developed through each needle. And today, the fact that we only use the filiform needle means that we need to develop those techniques within the use of the filiform needle, or possibly maybe bringing the 9 needles back in some ways. So we're going to talk about that. All right, let's go to the next page here. How do we move to the next page? How do we move to the next page? Do I just click?
Yeah, I was doing this.
Oh, I use this. Oh, okay.
Okay, I know what it is.
Oh, there we go. Use this. Okay. So here we go. Oh, back. All right. So in the Ling Shu, in the first scroll, the very first chapter, basically the very first book here, we have the idea of the 9 needles, right? So they're called the Zhoujian. And Zhoujian, the 9 needles, it means these 9 needles, but it also doesn't just mean needles. You can take it to mean the idea of these principles in needling, or even 9 steps of cultivation as a physician to develop these skills. And you'll notice as they go through that the needles themselves represent a movement of being able to treat from the exterior of the body, from the skin, right, the people and the sinew channels, the jinjing, towards the interior. And you'll notice as they go on, each needle builds on the previous needle and can be something that is either used on the exterior for something in the Wei level, right? Or it can be used something that moves into the Ying level, right? The interior, that Ying level of nutrients and Yin Qi. Or it can be something that affects the Yuan Qi, right? At the Yuan level. So all of these 9 needles have effects. And today we try to imitate that with the filiform that we have, but there are methods to it. And so we're going to go over that today. So there's a specific nature to each one of these needles. For example, the chisel needle, which treats the exterior of the body, doesn't treat Yuan Qi. It treats the Wei Qi on the exterior of the body. And so, but you might use a needle such as the Changjian, which is the long needle, right? And that would treat more Yuan Qi. So we're going to talk about that as we go through. Here we go. Just check this chat here real quick. All right, here we go. All right. So in the Ling Shu, the needles aren't presented just whatever. The order, whenever you read the Huangdi Nei Jing, is very, very important because the order actually shows a progression. There's a system to the way they're developing your techniques and their techniques to the way they're presenting something. And that in and of itself has meaning. So the needles are presented in a very specific order. And the order relates to their usage, starting from the most exterior Wei level, right? And then proceeding on to the Ying level, right? And then eventually to the Yuan level. And so when you're reading this in the Ling Shu, or as you'll see today, when you're practicing these techniques, practice them with the intention of first looking to affect the exterior, then affect the interior, then affect the deep level. And when you do that and you get good at that, you find that a lot of the needling, a lot of times when you needle certain points, the functions appear more clearly. For example, large intestine 11 to clear heat, right? Well, we say by its nature, it's on the Yangming channel, it's a Hesi point, right? But if that heat is on the exterior of the body, then the idea of just needling it perpendicularly and, needling it, 1 sun for depth or a half a sun for depth, that's kind of deep. Traditionally in the Ling Shu, they wouldn't even be using, large intestine 11 anyways. It wouldn't be a point that they would use, but just using that as an idea, the idea of chiseling and not piercing very deep would be something that may happen to move cause the body to express and open the Wei level. So the chiseling technique is one of the techniques we're going to go over today, because what we're going to do is we're going to build these techniques for you so that then when you analyze other techniques in the Ling Shu or you're needling or you're analyzing other needling techniques, you'll see where they fit into these 9 needle concepts, right? Because the 9 needles cover the majority of major needling techniques that you'll probably use in clinic. All right. So these are presented in a manner which doesn't just describe the way that you treat the patient, but the cultivation of the physician, of you, the physician. And I mean you guys as acupuncturists, you guys are physicians. You guys are doctors. Whether you hold a doctoral degree or not, if you take this practice seriously, then you're a daifu, right? Or an isheng, or you're a doctor, right? So when you're needling, you're not only cultivating to get a reaction in the patient, but you're cultivating yourself to be able to do these things to open up yourself and develop these skills. And these are going to take requirements on your end to practice. It's not just about putting needles in and letting it go, right? You have to actually do these techniques. And so there's a physical aspect to this. So for you guys today, get some needles out because you might want to practice with us. It's going to be a little more of a physical class. We're going to talk today about the idea of cultivating yourself through Qigong. And we're going to be going over some needling techniques today. So if you want to practice at home, the Qigong aspect of this class today is going to be based on Danzhuang and different aspects of that that you can use. I've read some things online where I've seen in some forums, people say, oh, it doesn't matter if you do Danzhuang or not. It doesn't affect your clinical practice. That's not true. That's spoken by people who don't actually train Danzhuang and Chinese medicine together or your acupuncture together or Tui knot together. It absolutely has a strong effect. And we're going to discuss that later on. So. Hold on here. Oh, there we go. So the 9 needles, what are they? So the way I normally, for you guys who don't come to my classes as much, the way I do these classes is I review in the beginning and then we do a second run by and then we get a little deeper into everything so you can kind of follow along. So the 9 needles, as you can see in this picture here we have on the screen in back of us, I give you a picture of the 9 needles, right? The Zhoujian. So starting with the first needle, the chisel needle, right? Or they call it the Chanjian. So this needle, as you can see from up here, you can see it's rounded, right? It's more rounded with a point. This one has a point. Some of them don't have a point. They're more like a chisel at the end. They come together. And this is going to be the shape of this needle. It kind of comes together into a point, but not always a needle point that comes out. This is going to be used for the exterior of the body, for the idea of the wei, right? The wei qi. You're looking to open the sinew channels. You're looking to open the area of the skin. Generally, you're not needling too deep. In most cases, it's going to be a very surface needling. We'll go over that in a bit. The second needle is called the yuanjian, the round needle. Now, I actually brought with me an example. These are my traveling acupuncture kits. When I travel, I make them up and I carry them with me just in case I see patients. So the yuanjian, the head of the needle is round, right? And it's, if you notice on, say, a Taishin, like a Japanese acupuncture device, a non-puncturing one, right? They don't puncture the skin. The head of this is also round. So some of these techniques are actually, we still have these needles or these aspects here. You can use them in similar ways, right? So some of these ancient needles had the same structure as some of the modern needles today. And so you can use these in similar ways, and we're going to go over this. So this is a Japanese Taishin, just as an example. Some of them have this handle, some are just a straight line. But you can see here the round head on the needle, right? And you can see here on the Taishin, even though it's small, if you guys have one at the very tip of the Taishin, it's round. I mean, we'll get a close-up later so you guys can see. All right, let's see here. All right. Oh, perfect. Thank you. We have our own 9 needles from the wall. Oh, you can? Okay, yeah. There you go. So here's an example. You can show that, yeah. So here's an example of the 9 needles that Tina brought in. So we're going to go over each one of these today slowly here. All right, great. Thanks, Sam. All right. You can just put it, yeah, wherever you want. All right. The next needle. The next needle is called Dijian. So sometimes you'll see this translated as spoon. Sometimes you'll see it translated as arrowhead. The idea is that it's a broader head, right? And it can get to things and you can use it to scoop, right? Almost like you're doing gua sha. So it can invigorate and move the blood and the fluids in the surface of the body to induce sweating and clear wind, right? We'll go over that in a bit. But you can see again, this is a non-insertion needle. It's round. This is a non-insertion needle. So the term gen, even though it means needle, doesn't always mean that it's going to insert. Sometimes it's an exterior stimulation that you're affecting the interior of the body. Whereas the other needles you see, this is pretty sharp. Yeah, sure. Oh, okay. Oh, does this work? Can they see it like that? All right. So you can see, oh, here we go. Perfect. So you can see here, this is sharp. This is sharp. This is sharp. This is sharp. These are all sharp, but these here are more dull, right? So you've got that. Then the next one you guys are familiar with who do bleeding, right, is the fengjian. This is the lance needle. And many of you probably use this today in your practices because you'll bleed, maybe you'll bleed Lule points, right, or varicosities, or certain areas to clear heat, right? So there's the idea of that. The next needle that you have is called the pijian. So the pijian is a knife needle, right? So in this case, it's like a sword, as you see here. Sometimes what'll happen is it'll come down, it'll only come to one side, but it's been very much like a scalpel. And this would have been used to cut fluid swellings, pustule swellings, things that might have been infected, carbuncles to drain them. So the needling would have been different, and we'll go over that, than the lance. The needle after that is the yuan li jian. So the yuan li jian is the idea of a round needle. The tip is more round, comes in, and then it becomes very sharp. It's finer. If you notice the shaft of the needle here, it's finer than the other needles that came before it. These are a little thicker. Yuan li jian is a little finer. So the next needle after that is the hao jian. Sometimes you'll hear it called the mao jian, the hair needle. It's the idea of today's filiform needle. It's very, very thin. And this needle could be something that would be threaded from one point to another in the past. It's the thinnest needle of the 9 needles, right? So it may have threaded between different points. It may have been used as an early intradermal. We'll discuss that a little later too. All right. The next needle is the changjian. So the changjian is the long needle. It's very long. As you can see, it's the longest of all the needles. And it can vary in size. The Lingshu gives a general size for these, and we're going to go over these. And then the last needle is the dajian. And so these two longer needles affect the yuan qi. So that's the idea for these. All right. So let's go over the next slide here. There we go. So first needle here, the changjian, the chisel needle. This will be the first needle we go over today in demonstration. I think if we have somebody, these are generally used for sinew issues. The chisel needle, the Lingshu in chapter 1 says, and the Chinese here, I basically gave you a rough translation of it on the backside. It says, Yiyue Changjian, which means speaking of the first one, to speak of the Changjian. Its length is 1 cun 6 fen, right? 1 cun 6 fen. So this idea of it being 1 cun 6 fen, and they say that it's the chisel needle has a big head with a sharp tip. It can be used to disperse the yang qi. So in the case of this idea in the length, pay attention to the fact that it doesn't always mean that's the length of the needle itself. It could mean that's the length of the depth of insertion. And it might not mean that the changjian is always going straight down, right? Because how would you go straight down in chisel? It could mean in this case, the way we're inserting it is obliquely into the body, 1.6 cun, but the actual needle itself could be a little longer. There's discrepancy over that. You hear a couple things back and forth. But this is the idea. You're needling with this changjian. It's got a sharp tip and you're dispersing yang. So what does that sound like? It sounds like it affects taiyang, right? It sounds like it's affecting the exterior of the body. And so when you think about points that release the exterior, right, induce sweating, think about the idea of the chisel needle. Keep that in mind. Keep these first 3 needles in mind when we go through and we do this. All right, let's see here. Just going to check the chat box because I see a bunch of messages. Oh, this is all stuff about volume. Donna's got you guys. All right. So the next one here. All right. The next needle is we just said is the yuan jian, or the round needle, right? So the round needle is the same length, right? It's 1 sun liu fen, right? 1 sun 6 fen. It's considered in the Neijing, they talk about it as being round and it has the shape of an egg. It's used for rubbing and massaging and dividing and separating the body so as not to injure the muscles. So it divides and disperses the qi. So you notice again, just like the chisel needle, it's clearing things out of the surface, right? It's not a needle that's really tonifying. It's a needle that's dispersing. So the techniques you're going to use for these are going to cause the exterior to release. They're going to cause dispersing of qi. They're going to cause sweating. They're going to cause things from catching colds, from catching wind, from catching these exterior pathogenic factors. That's the idea of the Yuanzhen. All right. All right, let's see here. Next one. So the next needle, a little more about the Dezhen, the spoon of the arrowhead needle. So this is a needle, it's sharper, and it's the size of a grain of millet. It controls the channels by touch, but does not penetrate so as to bring the qi, right? So it invigorates the movement of qi and blood, right? And it moves it down the channel. So it's sharp, but it doesn't penetrate. So even though it's sharp on the tip, it's not supposed to penetrate. So you'll notice as we go through these first three do what? They affect the exterior of the body, right? So keep that in mind because we're going to review that again. But the first three affect the exterior. They release the exterior, right? I will demonstrate a bit of channel needling later for things like the divergence or things like obviously the luo or the sinew channels. And you're going to notice a number of these needles as they build up will affect. So in this case, what do these first three needles affect? They affect the sinew channels, right? They're going to affect the wei qi, the yang qi on the exterior of the body. And so their techniques, think about those when you're using your filiform, because just inserting the filiform doesn't necessarily affect wei qi, especially if you're too deep, right? You're in the yin level. Also, I'd like to say too that if you needle too deep, you can drive the pathogen inwards. I used to run a clinic in Connecticut and New York. It was a very high volume clinic, right? It wasn't a community clinic. It was an actual full treatment clinic. We saw between 30 and 60 patients a day. It was a lot a day. And I opened the clinic in 2013. And when you're treating that many people, you sometimes, if you've, it wasn't just me, there were other people too, but a lot of times it was me running the entire day. And you have to be careful when you're needling that you don't drive some of these things inwards. So the technique that you're using is really important because if you're needling into the yin level, but the person has, or the yuan level, but the person has an exterior pathogen, you could be driving that xia qi, the evil qi, right, that they call it in the classics, into the depth of the body. And then they can get sicker. And I've seen that. I've made that mistake and had a patient come in and had a mild wind cold and I treated them and it developed into something that was much deeper. And so a lot of people like to say, oh, there's no side effects from acupuncture. You can't make people sicker. That's not true. If you do these things incorrectly, you can drive the pathogen in deeper, which is why you want a needle to help, clear out the exterior without driving this thing in deeper. Same thing with herbs, right? You don't want to give the wrong formula or else you can actually strengthen a pathogen or drive it into a place without expelling it. Acupuncture has those fine principles and techniques as well, but too many people today aren't taught them. So one of the reasons why we're going over this is for that. So, all right. So the idea of the fengzhen, right, is the lance needle. So again, this is a lance needle. You guys already know it's a lancet, right? You're going to bleed. They say again, it's 1 sun 6 fen length. So in some cases, you might not be needling that deep with this one because you're bleeding it. You're just bleeding the person. But the idea that some of these needles might actually be the needling depth, that's one of the ideas that certain scholars have given out over time. The lance needle has 3 cutting edges and may be used to affect chronic illness. So one of the things about the lance needles today is a lot of times they're flat, like diabetic needles, and they can have a really tiny edge. You can now buy, at least I can buy, and I know some people probably can buy larger needles like this. These are larger lance needles, and they have 3 faces to them. They have 3 cutting edges. Like sometimes you'll hear them in Chinese called sanmianzhen, which literally means the 3-faced needle. And so those 3 faces help it to open the hole when you're bleeding, and it helps blood to come out easier, a lot easier than the diabetic lancets a lot of times. So if you have trouble with bleeding, Also check the tool out that you're using because you want to make sure that it's large enough. Another thing is obviously now we can use the plum blossom hammer, and that makes things a lot easier, right? So you've got a bunch of those together on a head. So, and all of those, you know, are small lances that work well. So that would be something that you could use in replace of a Feng Jen today. The Pijian is the knife needle, right? And this one is longer. It's much longer. It's 4 cun long, and it's very interesting because the Lingshu says that it's 2 fen wide, 2.5 fen wide. So that means it's supposed to be larger. You're cutting into boils or lancing into some sort of pustule boil and then pulling it out and slicing to open it up, right? And this is the reason why it's like a knife. So the sword needle is like a sword. It may be used to press out large pustules. So in this case, you're treating actual infections and you're using it like a scalpel. I've done this in the clinic, in my clinics. I've treated infections. People have come in with, you know, pustule infections or things. In some cases, I've had a couple of people sent by their Western doctors because you pack it with herbs. Generally, it's sliced. You air it out. You pack it with herbs. You clean it. You pack it with herbs. You send them home. They heal very, very fast. So this is just my experience clinically with patients. All right, let's go to the next one here. Well, there we go. All right, so that's the Pijian, the knife needle. Some people will call it the sword needle. Either way, it's the same thing. All right. The next one, the Yuan Li Jian. So the idea of the round and the sharp needle. So the round and the sharp needle, the head is round. The round and sharp needle is large as a tuft of hair, they say in the Neijing. It is both round and sharp. The center of its body is a bit larger, and it is used to seize the abrupt and cruel qi. The idea here, you notice starting with the idea of the feng needle, the idea of the lance, and then the Pijian, and then the round and sharp needle. In these cases, you're dealing with the yin qi. So you're dealing with the idea of trying to treat yin qi, and we'll go over this a little later. But the idea of seizing the abrupt cruel qi in this case could be the outwelling of yin qi or some sort of heat from the yin level outwards and coming up, right? Some disharmony, some ni qi, some rebellious qi coming up, right? So this could be an idea that's happening. You're trying to reset that rebellion, right? Or you're trying to clear the heat that's going on in that. So this is the idea of the Yuan Li Jian, right? All right, the next one. So the next needle we have here is called the Hao Jian. This is today's filiform needle, right? So the filiform needle of today is the, let's go back, is the Yuan Li Jian. I'm just going to see if I can put this to the side here so it's not in my way. All right. So this Hao needle or Mao needle is fine, right? It's a fine needle. It's 3 cun long. I'm sorry, I don't have the English here next to it. I must have forgotten this one. So it's 3 cun long, 6 fen, or 3 cun, 6 fen long. That's how long it is. It says Chang San Sun Liu Fen. So it's 3 cun, 6 fen long. If you guys want to write those notes down right there. The hair fine needle or the fine needle has a tip like a mosquito or a gadfly beak. So that means it's really, really thin, right? That's our modern filiform needle. It can be inserted slowly and quietly and detained for a long time to nourish the idea of the Zhen Qi, the true Qi. It may be used to reach the sickness of painful rheumatism. What does that mean? It means that it can be needled into the area of Bi Zheng, of Bi obstruction, where oftentimes a person has deficiency, and you can use it to tonify over time. And we'll talk about that. And they'll leave that there. So, all right, hold on. We've got a question here. Jennifer said, I have heard that acupuncture lancet needles, 3-edged needles, are not as sharp as diabetic lancets. So are they less preferred for bleeding because more painful from the point of view of the patient? Personally, I personally don't like diabetic lancets because of the fact that, you know where the plastic handle gets in the way of where you can see the tip of the needle? I don't like that because I need to see where the varicosities are that I'm bleeding, right? So I tend to buy flat metal lancets. Sometimes you can get tattoo needles or piercing needles. Sometimes I get like a flat lancet. There's a company out on Long Island that makes these flat lances, and they're like it's almost like a flat piece of sheet metal, and the end comes down, and then it comes out into a tip. I actually have them here. somewhere. Here's my other, I have two carrying cases. Here we go. So they're called MediPoint lancets. And I'll give one to Sam so he can show you guys. I like these because you can see what you're bleeding. They're really flat. They're really easy. But they're called MediPoint lancets, and they can pull right out of paper. You just rip the paper open and pull them right out. And I like them. My patients don't really complain about them too much. I haven't really had an issue with the idea of the 3-edge needles with patients because you're not inserting very deeply. And I've been doing this for so long, it's quick, right? So even the short amount of discomfort they might have gets better. Here, let me give this to Tina. You guys can compare right in front of the needle or right in front of the camera if you want to open one of those up and show them as a comparison. So Sam is holding a lancet that I commonly use in clinic. But this is the other lancet. This is the 3-edge needle. And this one has 3 edges, and you can compare the two here on camera so you can see the difference of what you're using. All right. We're just going to show you a comparison. Sam is a really good hand model, by the way, if anybody out there needs a hand model. So you see the off screen. So here we go. So we have, there we go. The one that Sam is holding that's thin is the 3-headed needle, the 3-edge needle. And the other one in the paper packet that he pulled out is the, hold on real quick. We'll get this so you guys can see. There we go. So that's the MediPoint lancet that I use. And then this is a 3-edge needle. I like to use these as well, but they're more expensive and they're oftentimes a little harder to find. So when I find them, I buy them in bulk. I find that they open the holes better, but that's just me clinically, what I find is easy. All right. Thank you for your question. If you guys have any more questions, put them in the chat box. I don't mind answering them. And we'll answer those. All right. Here we go. So yes, I'm sorry. It says somebody's asking 3-sun or 6. It's called 3-sun 6-fen, right? That's the idea here. 6-fen, 3.6 sun. Yeah, it's the idea in that case. Yeah, go ahead. Yeah. And that's considered thin back then. So these may have been used as intradermals too. We'll talk about that later, where they actually insert them and leave them in the body for continuous stimulation. So, all right. Let's go next one here. So the last 2 needles. So the last 2 here are going to deal more with Yuan-Qi, and we'll talk about this in a bit. The Changzhen, or the long needle, right? The long needle has a lance like this one. I'm sorry, I must have forgotten in these last few the English, but this one here is 7 sun is the length of this. 7 sun. So the length of the long needle has a lance-like edge and a thin body so that it may be used to reach distant paralysis and deep rheumatism. In this case, they're talking about like bone B and things that are very, very deep, right? B that's very deep in the Yuan level. And so you're needling all the way down, right? And you're needling all the way down through the tip of that thing. Do you have the ability to needle all the way down there? The needle may go there, but when I say, do you have the ability? The question is, it's not just about putting the needle in. It's also about the skills that we're going to talk about, the techniques that are used. Do you have the ability to express that through the needle and out through the end of the tip and into the body? Like, that's a major thing. This is what kind of separates the wheat from the chaff as far as skills go in acupuncture. And this is really, really important. Yes, you need good diagnosis. You need good strategy as far as what treatment you're going to choose. But part of that strategy is needling technique. And that oftentimes gets overlooked, right? Sure, the needles do things by inserting in the points, but do you activate the points by just needling them? Or do you activate the points by using the correct technique when you needle them? And that's what I'm here to, suggest today, that you activate the point by using the correct technique when needling them. All right. And the last one here, the dajen. So the dajen is a big needle. Again, I'm sorry, I was writing these and I forgot these last few to write in English here. But the idea is that this is the 9th needle. Its length is 4 sun, right? 长子sun. So the idea here is that it's 4 sun long, right? The big needle is tipped like a stick and its point is slightly round. It may be used to disperse water at the moving gates. What are the moving gates? Your joints, right? In the Lingshu, you'll see them referred to these joints as the idea of guan, right, of gates. You'll also see them referred to as kong. So the idea of these empty spaces that are sitting here that you're going to be moving qi through, right? So the idea of guan or kong, both are expressed in the Lingshu. So you're using this needle, it's big, you're using this to move and disperse water that swells in and around the joints. And that's, you need to get in deep, you're going in deep to the joint. So that's the idea here. This is going to be, where's the joint? The joint is where what? Your en-qi sits, right? It's where a lot of times the way level, the sinews come inwards and they anchor into the joints, into the bones. So it's where the way level and the yuan level connect. For any of you guys who have taken my class on Intro to Treating Pain with Channel Theory, if you guys remember, I talked about the divergence are where a lot of the divergent areas are where the large joints are, right? The knees, the shoulders, right? The neck. These are areas where the Wei Qi comes into the Yuan Qi. So the idea of treating those areas is really important. So that's what the dajen in some cases may be treating that, right? And so today you might use a longer filiform needle, right? You might do these longer filiform needles and things like that. All right. Somebody wrote, trying to release water at the surface or near, inside the joints. So you'd be doing this like generally if you can feel the swelling deep inside, the joint is swollen, you'd be using this needle to move the water deep inside, that's deep inside the joint, causing it to swell from the center. Somebody asked here, where do you get the 3-edged needles? I will see if I can find a location. I work in Chinatown. And so because I work in Chinatown, I speak Mandarin, I know what I'm asking for. And when you can say it in Chinese, they're like, oh, that's what you want. Sure, right over here. And they dust off a dusty shelf and pull out an old box and give you what they have in the back. But I'm sure we can look, and I'll talk to Tina and Donna and see if we can find something that we can, maybe a place that you can buy them online. I don't know a place online. I buy them firsthand. And normally when I buy them, I buy the entire box. So if I find a Sanmian Jen box, I buy the whole thing and I just keep it with me because I don't always use them. But when I do use them, they're very, very useful. All right. Let's see. All right. Next thing here. All right. All right. So now we've been through the 9 needles, right? We're going to review these over and over again as we build up because I want you to understand the method that's going on. But before we get too far in today, we are going to review a bit of Qigong because this is also really important. Because when you use these 9 needles, what happens? You need to be able to move and project Qi into the person. You need to project these things into the person, whatever the technique is. And just like, oh, it's my intention. I'm using my intention. Well, that's nice and well. But my intention could be to punch Mike Tyson in the face, and his intention could be to punch me in the face. And it doesn't matter how good my intention is. He's beat me on skill, and it can look like he uses a lot less effort to beat me. And so no, regardless of how much I want to do it, he's going to beat me every time. So building that intention, but also building the physical practice of it, coupled together, creates for more efficiency and a better result later on, right? And so one of the ways to do this is obviously needling, but the second thing is to use the Qigong, right? So Qigong is another thing here that's really important as an acupuncturist specifically, because it's a physical modality, right? And now after seeing these 9 needles, how many of you would say that in many cases, according to Ling Shu, acupuncture is surgery, right? It's like an early surgery, the way that they're doing it. I know some people are like, don't say surgery, but it's the truth. You know, we had these scalpel-like needles, we call the knife needles, right? We had the fengjian, right? The pijian. You're using chiseling needles, you're doing these different things. In some cases later on, you'll see when they talk about needling in certain areas, they say, in this case, be sure not to make the person bleed here, do this. Very similar, like you'd want to avoid doing surgery, you'd want to avoid certain arteries, certain blood vessels. Other times you're actually cutting in to clear things. So there's a lot of physical aspects to this. So with that said, you also want to train yourself physically through the ability to move the needles correctly, but also the Qigong aspects that go along with it, right? So let's see. So what are 3 ideas here when you're training Qigong for medicine to get as a better acupuncturist, to become a better acupuncturist? It's not the same thing as if you're training martially. And it's not always the same thing as if you're training for health. If you're training for health to make yourself healthier, that might be a different methods. There might be different methods used in Qigong. You could still become healthy from practicing this Qigong, but the goal isn't necessarily your betterment of health, even though that might be a side effect. The goal in this Qigong is to help make you the better acupuncturist, right? So what happens here? What happens here? So the idea is that we want to look at 3 major things. One big thing is to open up the joints of the arms. Open up the joints, so shoulders, elbows, wrists, right? So you can project and get the fingers connected, right? The second thing is the ability to connect with the earth, pressing downwards, right, into the ground. And the third thing is what? Connecting up into heaven, extending the neck. So when you open the joints of the arms, I said the 3 joints here, we're going to do, the idea is that these are going to be associated with needle technique, right? To be able to issue your qi, fa qi, to emit your qi, to move theirs. Even if you're not moving your qi into the body, you physically have to move it through the needle to affect their qi, right? To affect the person. And so you have to open up these areas, right? The other thing is it's not just opening these up, it's also the ability to get it down to the fingertips, to get these fingertips strong. And this is another thing that has to happen, because you can't just be like, oh, my fingers are relaxed when I needle. There has to be some sort of almost like not just an intention, but a strength in your fingertips when you're needling for certain things, or else you're not going to get those reactions all the time in the patient. Over time, you'll learn how to do it more gently with less strain, but you still have to have a physical effort in it in the beginning, along with the idea of conducting the qi, right? The ability to connect to the earth, this is the idea of what? Standing stably, right? With the legs connected and the toes pressing down and gripping the earth, right? And the knees relaxed and slightly bent, right? This is the idea. You're not straight-legged, you're not super, super tight, right? If your knees are relaxed and slightly bent, you can spend the entire day needling people, right? And not feel tired at the end of the day. You don't feel like, oh, my back, I'm not strained. Make sure your bed is high enough. Don't put your bed too low so you're bending over, but make sure the beds for the patients are high enough. But the idea is that you shouldn't feel like you've been standing all day and being super, super tired if you're holding this posture correctly. That, and also the idea of flexibility, right? Stretching and doing these things, right? This is also the idea of helping you, from getting injured while you're practicing acupuncture, because it can injure you. I've had patients who are acupuncturists. I've had patients who were chiropractors, all injure themselves from repeated motion injury and from having bad posture while they're doing things. And how can they do the best that they can do in whatever techniques they're using if they have the bad posture, if they don't have the power to do things, and also the dexterity to do things, right? So this is important because your dexterity of needling, your dexterity of your body is really important when doing tuina, right? When doing needling. So these things really need to be worked on. So I'm going to talk about a couple of things for Qigong, but I'm also going to mention at the end of the day today, I left a link for a sort of like a mixture of like the I Ching Jing, the muscle tendon changing, the Ba Duan Jin, the 8 silk brocade, and the Tai Chi Qigong. There was a doctor in China. He was an orthopedic surgeon in the 1950s, and he had studied all these things with some very famous people back when he was young. And he took them and put them together in a set called Shibafa. Sometimes you'll see it called Liang Gong Shibafa. And it just means to train these Shibafa. Shibafa means 18 methods. And in my clinical experience in all my years, I've lived in China for many years. I've lived in Taiwan for a number of years. I've trained martial arts for a long time. I've trained Chinese martial arts. I've trained Japanese martial arts. I've even trained boxing and some jujitsu and some other things. Wrestling. This is the single best packaged all-in-one series of exercises. Doesn't necessarily cover everything, but the amount it covers and the fact that it's packaged together and the fact that it can help you as an acupuncturist get the qi to the fingertips and develop power in the fingertips, it's excellent. So I left you a video taught by a good friend of mine, Simon Lockett, who actually learned from a man who lived with a doctor for 6 months to learn this set, at the end of the notes today. So you guys can go and look at that. It's on YouTube. And Simon and I are going to be producing high quality versions of this, instructional versions of this. And Simon actually teaches an online class for this. So if any of you guys are interested for your own health, but also the idea of for your patients, it'll treat their joints, but also for yourself to get the chi to the needle, I can give you that information. Simon teaches an online class on Sundays, and we actually have chiropractors. We have some acupuncturists. We have massage therapists in this, and it works. They all love it. They seem to, once they join it, they seem to love it. So, all right. So this Qigong here, the last thing we want to do is the ability to connect with heaven, right? So we want our neck relaxed, but pushing upwards gently, not straining. The idea of pushing upwards. Some people will say, feel your head suspended like it's on a string. You could do that. Or the idea of it pushing up just slightly through Bai Hui, right? The back is slightly rounded and the chest is relaxed. And the reason why is that this extends Taiyang, right? I mean, I can now extend out through my arms when I'm needling, when I'm massaging, when I'm doing, Tui or doing anything like that. I'm extending through the back. The chest is relaxed. All right. So, somebody says, please share the info for the Sunday class. I will. I'll make sure at the end of today. Anybody who wants that information can email my email address that I'm leaving at the end, and I will connect you with Simon, and you guys can join if you're interested, or you can talk to him about it. All right. So what does this mean? Well, from a martial arts point of view, they've talked a lot about the idea of Qigong and the correct alignment that helps you be the best in issuing power or doing what you need to do, emitting force through the fingers, right? Or the toes in this case, or the body. They even have phrases, they have sayings that are all about this. I personally don't practice Taiji Chuan, but I practice Baguazhang. And the sayings are very similar. Oh, let's see. So these are called Shenfa, or body method, right? Body skills. We need them in acupuncture as much as you have the people who do martial arts. You have to have good body method to conduct Qi, right? So this is one of the important things. So the posture or the body method that are practiced in Qigong and Tai Chi, Xingyi Chuan, if any of you guys do Xingyi Chuan, or Baguazhang, if any of you guys do Baguazhang, and shout out if any of you guys do any of these martial arts, because it's great to see other people who practice these martial arts and practice acupuncture. That's great. So if any of you guys do that, throw that up in the chat so I can see that. You want to apply this to your acupuncture training, right? You have to open the gates. What are the gates? The Kongjian, the empty spaces, the shoulders, the elbows, the wrists, right? Even the knees, right? The hips, the ankles. You want to get this to, you don't want to be crunched while you're doing acupuncture. You're sitting here all day and you're like this and your neck's down and you're still trying to needle. You want to be expanded, right? If you're going to move Qi in somebody else, how are you going to move it in yourself if you're all tight? So practicing these things are really important, right? You need the Qi to flow freely in your limbs. You want the power to come from your legs, but they still have to be relaxed, and you want to issue it through your arms when you're needling, right? So great. We have some people here who practice Gong Fu and Yang style Taiji. Good for you. Good for you. That's good to hear. Taiji Chuan. Awesome. Awesome. All right. So there's a saying both in Xingyi and Taiji. Now, some Taiji people get upset when you tell them it actually comes from the Xingyi classics, but Xingyi is older. But it's shared, right? And in Bagua, we just use different set of words, but it means the same thing. So what we say, I wrote it out in Chinese for you, and I wrote the pinyin here. So it says, Han Shong Ba Bei, Di Gang Shou Kwa, Shu Ling Ding Jin, or Ding Jin, Chen Jian Zui Zhou. So what it means is the idea of Han Shong is to empty the chest. What does emptying the chest mean? So I'm just going to stand up so you can see me a little bit. Is that all right? All right. So when you empty the chest, it doesn't mean like you're like this. It just means that this just relaxes a little bit. So notice from the side here, when I'm here, if I'm needling, right, I don't want to be stiff and I don't want to be like this. I relax and I expand my back. So Han Chong Ba Bei, what it means is to relax the chest, empty the chest, and draw out the back. Drawing out is like this. So if I'm going to needle, I'm not going to be like this. I'm not going to be like this. I'm going to just relax, open the chest, just like Tai Chi when you see them open, and they come here, right? You're going to open, and then you can needle from here. Han Chong Ba Bei. Qi Gang means to lift Ren 1, or the anus internally. Shou Kwa means to relax the Kwa underneath. So you're kind of almost sitting, almost like you're about to sit down, right? I'm not stiff all day needling, right? You want to relax as you do it. So these are going to be the ideas to these standing methods as well. The next one here is going to be the idea of Shuling. The idea of Shuling is to empty the mind of thoughts that distract you from this moment. You don't want to get if you're treating somebody, you don't want to be thinking about, did I put the money in the parking meter for my car, right? You're about to put needles in the person. You're about to bleed the person. You're about to needle deeply into an area that could be around an organ. You want to have the mind clear, right? And the next thing here is that the crown of the head is erect, right? So this comes up. You sink the shoulders. So Qianjian means the shoulders relax downwards. If you have trouble with that, one of the things you can do is roll your shoulders. Practice rolling. So you're here, rolling the shoulders forward, under, and then here. Do that about 25 times each way. Your shoulders will relax, right? You'll open up. That opens up the idea of the Jianjing, the shoulder well, right? And you'll find that this opens up this point. You can even give this idea to your patients as a homework. Rolling, right? Rolling forward. I roll forward. I roll backwards, right? I roll forwards. I roll backwards. And then you can go the other way, right? And I'll do, as a warm-up a lot of times in the morning, I'll do 100 each way. Your shoulders feel warm. Notice my shoulders are more down than they were before. It will release the shoulders, right? So the idea of sinking the shoulders. And then when you're needling, you don't want to needle out here, right? You want your elbow to hang. I know it seems like common sense, but you'd be surprised. Even myself, sometimes when I'm in clinic, I'm doing things a lot and I'm falling out of posture because I'm not paying attention to what I'm doing. The needling doesn't have the same effect, right? So the idea of letting the elbows hang, right? So this is going to be a major base for our standing that we're going to be doing in a little bit that I'll go over. And it's a major base for practicing Taiji. So Bagua has 8 characters, right, that describe the same thing, right? They call it Ta Kou Ti Ding Guo Chui Song Suo. So the idea here is Bagua, they walk a lot more. So it's the idea of walking, striding, not just walking tight and short steps. The idea of hooking, the idea of rounding, lifting, the crown of the head goes up. You wrap the body. So their idea is that you're wrapping to get power out to the fingers. And we'll discuss this in a little bit. When you're needling, how does that affect your needling? There's actually an effect there. The idea of hanging, relaxing the elbows, relaxing the knees, and then withdrawing, meaning bringing up the quad, withdrawing into oneself. So these are these ideas, and they're really important because as you practice them over time, you're doing this standing meditation. One of the things is whether you're standing, you're holding your arms out and you're relaxing your shoulders down, you're getting your shoulders to relax. Over time, it's going to open your shoulders, right? And there are many different methods for this we'll talk about for different Zhanzhuang. People have the different methods. Some are up high, some are down low. But the idea of holding this, and you might hold this for a half an hour, it's not easy, but it builds your shoulders and it allows them to relax, right? And it also opens the upper back, right? Elbows are hanging, wrists are relaxed. So as you're doing this over time, all of this is relaxing and opening. So let's go to the next thing here. We're going to go over 3 standing postures. The 3 standing postures that I'd like you guys, if any of you guys ever practiced these before, if you have, throw it up in the chat. The idea of Zhanzhuang, post standing, right? If any of you practice Xing Yi Quan, then you have the idea of Santi, sure, which is the idea of the 3 substances position, right? Man, heaven, earth, right? Jing Qi Shen. It's a metaphor for what you're developing when you're practicing this, right? It's that, and we'll go over this. And the last one in Bagua is the one that you see when they're over here. So Zhanzhuang can be held in many postures, right? We'll talk about this. And then Santi Shi is generally held forward where you're turned slightly. I'm not a Xing Yi practitioner, but I know a little bit, so I can just express that a little bit. And then Qian San Lian Shi is the idea they call heaven 3 linking posture. You'll see this in some systems. Sometimes you'll hear it called the guard posture where you're holding out. And we're going to discuss this next before we get into any more needling techniques today. Some people said, yes, they practice Xing Yi, good. Santi is a phenomenal qi developing exercise for you guys who have ever done it. It's not easy. You guys know who do it. It's not easy, but it develops good qi to the fingers as long as you're following the correct principles. Good. Some people practice Bagua postures. Bagua has what they call Ding Shi. They're fixed positions. And so you'll see sometimes they'll walk the circle, their arms will be out, And there's the same method to the standing, except you're walking with it, right? You're pressing out to the fingertips. Your fingertips are spreading. So we're going to go over these. Some people have done embrace the pose standing. Good. And this is the same idea from Yi Quan, and they do it on a single leg. These are all excellent. These are things you should maintain when you're practicing acupuncture because they open the shoulders, they open the elbows, they open the wrists for you to get that power out there. And for anybody who does Tui Na here, you know too, I assume most of you guys probably do Tui Na if you do Genjo, right, acupuncture, that anybody who does Tui Na and does these standing exercises, you know your Tui Na is always more powerful, right, because it's building, right? Very famous Tui Na teachers, they do a lot of these things. People who are very good, they do standing exercises, develop power. These are really important, right? So these three postures, we're going to I'm going to show you some pictures, and then I'm going to give you some small insight into how to practice each one, and then we're going to do them, right? So I hope you guys are ready to get up and do this a little bit this morning, because this is going to be a physical class. I managed to sneak this in so that we can do a little physical application today. All right, so here we go. This is Wang Shujin. So he's dead now, but he was very famous in Taiwan, and I think he was in Shanghai, if I'm not mistaken. He's doing Jianzhuang. He's doing post standing or embracing post posture, right? So there are many positions that can be held. The basic posture to start with is the feet even or under the shoulders, right? Basic arm postures can be held at the side. They can be held anywhere in front of the body. Some people hold high. Some people are even up high in Yichuan. They're here. Some people hold different angles, right? They can go here. They can go lower. We'll explain. There's a lot of things. The idea, okay, you're here. You're cultivating the third eye, right? You're here. You're cultivating the idea of the heart, right? Over Tanzhong, right? Or the belly of the Dantian over Renhai, right? The belly, Ren 6, right? So there are these different methods that go, and Yichuan pulled a lot of its postures from things like Xingyi and Bagua and Taiji, and they developed them, right? More and Taoist Qigong, right? And so they developed on them, and that's where a lot of their postures come from today, right? So there can be a lot of different things when you're doing Jianzhuang. Jianzhuang, I mean, they have what they call Bagua Zhuang, which just means Bagua standing postures, Xingyi Zhuang, which is Xingyi standing postures. And so you can do these postures, and they will open the shoulders if done correctly, the elbows, the wrists, and if you're pushing your head up, you're opening up the neck. If you're pushing your feet down and gripping the ground, you're going to help generate that power that you can then use when you're doing Tui Na, when you're needling, when you're doing anything like that, right? So that's really important here. All right, the next one, and we're going to stand up after I introduce these, and we're going to talk about them. So the next one here is Santi Shi, right? So Santi Shi, it looks a little different. The body is upright, right? One leg is forward and one leg is behind. Now you notice his hand is somewhere down by the dantian in this case. Sometimes it can be under the elbow more. Sometimes it can be down more. It depends. You'll see many different variations depending on what school and what the intention or what the goal behind that exercise is, right? Weight distribution can differ in Santi Shi depending on style or training or what you're trying to go for in that case. But this is an excellent, excellent, excellent exercise to build qi, especially if you're going to be doing Qigong therapy, acupuncture, right? Or Tui Na, right? So Santi Shi. The last one may be, Santi Shi is much more difficult than Jianzhuang because a lot of times you're more weighted on one leg than the other. Now you can do one-legged Jianzhuang or shift the weight back and forth, and you can totally practice that, and that's good to practice. It makes you strong, gives you more power. But the same thing with Santi Shi. A lot of times it's 30-70, sometimes it's 50-50. So again, there are differences. All right, and the next one here. Oh. The last one is called Qian San Lian. So this is actually a picture of my Shifu when he was in Australia doing this. So this is this Bagua posture where you're facing the center. Sometimes they call it Long Jua Tan, which means like or Long Tan Jua, which means the idea of like dragon extending its claws. In our system, they call it heaven, Qian, as in like the heaven Gua from the trigram, 3 linking. Why do they call it that? Well, the reason why they call it that is because you have 3 places you're going to keep your hands when you're practicing this. The first one is the tip of the outer palm is in line with the eyebrows, right? And the elbow is dropped, just like we said before, it hangs, right? Then as we push the second palm through, you guys can see here, this palm tip is underneath my elbow. And then the third thing is my arm crosses in front of Ren 14 to cover it. Having those 3 things in connection means 3 linking, right? So heaven 3 linking, that's the idea. Now the feet are standing is pointed away from the center of a circle generally, and the waist is rotated towards the center to get wrapping, right? And then the tip of the palm, as I said, eyebrow. Other one is under the elbow, and the third one is over the other elbow is over the heart, right? So these are important. So we're going to actually do these right now. Let me go back here so you can see. Keep these ideas in mind here, the body posture when we do this. So we're going to stand up here. We're just going to go over this a bit. So if for you people who have not done Zanzhuang before, can you get me all in the shot? Is it all good? All right. So the idea here is we're standing. You can start here. You can start relaxed. You're just going to bend your knees a little bit, right? You're going to bring one leg up, and it's going to step out underneath the elbow, right? And then the arms can come up just in front of the chest, right? Now look at me from the side. This butt slightly tucks underneath as if I'm about to sit down. What it does, watch my legs. See how it turns out? So what it does is as that happens, it's as if I'm about to sit down, right? And my shoulders are up, my back is rounded, my arms come up, elbows hang. In this case, people have arms differently. Some are out more, some are over the knees. You're relaxing, my head is up. Notice my back is rounded, right? I'm not here. I'm relaxing, I'm emptying the chest, I'm sitting down. And you can sit and hold this. Now here's the important thing too, not to forget. My hands aren't here. They're extended through. So what happens is, can I use you real quick? Yeah, come here. So when she presses on my fingers, press on my finger. My fingers aren't this. My fingers are this. She presses, it's force, right? It's power on them. Good, thanks. So you're not here. You're pressing as if you're stretching the fingers, right? And this stretch, you should feel it come from the back. Watch my back. You'll see it very subtly. See how my back moves? Can you guys see that? Can you see that? My back moves forward as I extend my fingers forward. So I feel the stretch in the sinew channels all the way around to Da Jue, do 14. What am I doing? As I'm doing this and I'm sitting down, I'm activating Taiyang, right? This is going to be important because as you get this down, it's going to relax the shoulders. Then what's going to happen when you're treating, it's going to relax the elbows and the wrists over time, but you're still going to have power in them. So when you're treating and you're using the first three needles, right? The chisel needle, the spoon needle, right? And the round needle, right? You're going to actually be doing what? As you're needling, you're trying to release Taiyang to get them to sweat. You're trying to induce the Wei Qi to move and sweat. So by doing this, you're strengthening Taiyang in your own body. You're actually doing the technique from the Taiyang Jing, right? From the small intestine channel, right? So, and it's connecting, you're pushing down against the ground and extending out. That's bladder Taiyang, right? That's Zhu Taiyang. So you're connecting Shou Taiyang, the hand Taiyang, with Zhu Taiyang, the foot Taiyang. So you're actually expanding that. So when you needle, you're going to be projecting that into the person. Does that make sense? So all of these needle techniques are a cultivation of you as a physician in your personal body and your ability to treat the person, right? So this is the first one. So we're here. So we're under the shoulders. We're just sitting slightly, knees are slightly bent, right? And I'm here. Now people can go here to release the shoulders. Some people go here, right? Some people are down low. Some people are just here. Now if you're here, don't just let your fingers just sit. Stretch them a little bit. Keep them slightly stretched. You can feel, can you feel that? Anybody on, you can write in the chat and I'll see it once I sit back down. As you do this, breathe. Can you feel your fingers start to heat up? Can you feel them start to heat up as you stretch down? If you feel them start to heat up, you feel them start to, as you expand, you can feel them start to heat up, you're leading qi to the area, right? See my hands start to get blotchy as I do this. I've done this for so many years now, it starts to, right? When the qi moves, it moves the blood, right? So you start to get that to the fingertips, right? So there are many different positions. One position that was really popular is here. This is a good one also for acupuncture. You're here and you stretch down. Imagine there's a ball just outside of your fingertips. Stretch, it's always just outside. So you round your arms and this is wrapped and you're stretching down. You might feel an ache. The more you stretch down, the more you feel an ache in your forearms. And you feel that all the way down to the fingers and you feel it connect all the way up to here and all the way into the back, all the way down through the feet. So what happens is when you do that, over time you sit here 5 minutes, 10 minutes, 15 minutes. When you finally grab that needle, you grab it and you can feel it from here, your fingertips, connected all the way through. That's going to change, right? That's going to change your ability to do acupuncture at a much better level. And you're also literally inducing a Taiyang state in yourself. So when you needle somebody, you can induce that principle through the needle, the chisel needle, the round needle, or the spoon needle, right? So the next one, Santi Shuren. I'm not a Shingi person, but I've done a little bit of training in it, so I can give at least a little introduction to this. The idea here, just tie this shoe before it comes off here. All right, is you could start with your feet together, or you could start with one foot. Some people start here. Again, I'm not a Shingi person, so any sort of critique, people might teach it differently, that's fine. Shingi really isn't what I do, so start here or start here. And the idea, though, is just for acupuncture-wise, what we're going to do is we're going to step out. So we bend down. They call this a chicken step. You bend down, and you step out. Now, as I step out like that, I just step forward. Now, if I start my feet together, what I do is I step off to the side. I can just step here. Some people will turn like this so that when they step out, they step here, right? So as I step out, I'm going to look like this. I'm going to step towards the camera real quick. So I'm going to step towards Sam. I'm going to come up. My hands are going to come up and down. So now I'm here. This leg is pushed out. This leg is forward. My hands come up and stretch here. So I stretch out to the fingertips. I sit in the same way that I did the Janzhuang. I sit down, right? So I'm going to feel pressure on my legs. I'm going to feel this muscle is pretty tight, and this muscle is pretty relaxed, right? You can see this massage. This one, it's hard, right? This arm comes up, and I'm here. Sometimes people like to go more forward, but the same principles are involved. Watch this. Sam sees me. I'm going to turn this way when I step out. So I'm here. I don't have to go as far. You can stay in tighter. Again, we're not practicing this for martial arts, just for chi and for acupuncture ability. So we're here, and I turn slightly. I round my back. I sit and tuck my tailbone. I feel as I do that, you'll feel this get really heavy in your back leg, and you're going to switch legs. I'm here. Now notice my fingers aren't here. They're stretching out. You want that stretch. It's really important that your fingers are activated. Your fingertips are activated, stretching out. And I'm sitting. My back is rounded. Chest is hollowed. Shou Kwa, the Kwa comes down. Shou Kwa means to receive. It comes down and underneath like this. Lifting Ren 1 internally. I'm here. Head is up. I'm just going to breathe. And I can shift forward and go 50-50 if I'm tired, or you can just change, right? So I'm here. This is rounded. This is hanging. I relax my shoulders. I'm going to hold this, 5 minutes, 10 minutes, 15 minutes. If you do this as a warm-up before your clinic, you do 10 minutes one side, 10 minutes the other side, even if you have to do them in 2 or 3 sections, you're going to notice as the stretch happens over time, your needling is going to become more direct, and it's going to have a lot more effect when you needle. So that's Santi Shu, right? So I'm here. And the idea, there's a lot of things that go into it. I'm just giving you a brief overview. There's a lot of wrapping, gripping the ground with the toes and turning. If any of you guys are interested, Sun Lutang wrote a great book on this, so you can get his book. Brian Jacobs, he just wrote a book called Dragon Body. I don't know the name, but if you look up Byron Jacobs, BYRON JACOBS. He just came out with a book. He's a friend of mine. He lives in Beijing, and he runs the Drunken Boxing podcast. I've actually been on it before. You'll see the book that just came out. It's on Xing Yi Quan, and he's very, very accomplished in Xing Yi Quan. Last one here. All right, this is the one I do. So I do Baguazhang. So with Baguazhang, same thing. You can start with your feet together, right? And as I step out, my knees are here. I step out, and this is going to turn, like I'm turning around a circle this way, right? If I want to go a little wider, I can turn this foot out a little bit, 45, and I can step like this. It might be a little more stable in the beginning. Like there's a circle to the back of me here, right? Then what's going to happen is this arm is going to come up this way and turn over. So it looks like this. This arm, I'll do it the traditional way here. Here. So most of the weight is on this leg, right? I'm not turning my hips like this. That'll put me off balance. My hips stay forward. My waist turns. My belly button is right here. Watch this. See? I turn as much as possible. And then going this way. It's hard in the beginning
It's pretty hard to turn that belly button, isn't it? It's hard to get your belly button to turn the other way around. It'll loosen dai mai, right? So this is good for loosening up dai mai, right? And eventually it'll start to face, notice my belly button starts to face in the opposite direction as much as possible. And now I'm here. So this comes across and down, and this sinks. This presses out. This presses forward, sanlian, right? The idea of 3 linking, eyebrows, under the elbow, pressing out, and the elbow here covering here. And I'm breathing. I relax down. Remember, this sinks. You're going to feel it in your quads, and you're here, and you're pressing. And I press forward. I relax my elbows. I relax my shoulders. I press my wrists out, but try to relax them, and I'm extending my fingers upwards. You can go like this if you want. Some Bagua systems do this. We start here. You can also extend your fingers this way. My fingers are alive. They're not dead, right? You have to have that power in them. And you start to sweat, right? The idea of releasing Taiyang at the same time. So I'm here. If you want to change, an easy way to change is this. If you're just doing the standing, turn this here. See my foot? Turns out, shift, forward, pick up, here. Now I turn this way. I have a new student named Tina Chen. She's doing a great job. And then we're here.
Well, I think, Mark, we should all practice with you.
Yeah.
Let the audience step-by-step practice with you.
Sure, yeah.
It's one thing looking at you, another thing
Doing it. Yeah.
It's really hard.
It's hard.
I just cannot get my foot in the back to be straight like yours.
Yeah, this takes many years of training. So, and this isn't easy. This is considered the earlier version. So, meaning the easier version. So you can do it high. You don't have to go low. I know I go low, but the idea is you're twisting, twisting, twisting. My belly button is now pointing towards Tina, and that's tough. But the idea is just go light, and then you're here, and then you're pressing out. And over time, what you're going to find is even if you're just here, you can't turn all the way. That's fine. Take it easy. And just try to turn this a little bit more and a little bit more. And then over time, you're going to be able to have that energy in your hands, right? So we'll give this one a shot. So you can do Jianzhuang, or you can do this. We'll go do this one a shot real quick. We'll go nice and slow. If you guys want to stand up, we'll take it easy. We'll go really slow. So, all right. And again, the reason why, if you guys can feel it, is you'll be able to feel it in the hands. Let me just look to see if you have any questions first. And then, we do. Okay, hold on, let's see. All right, here, let's see. We have a question here. Can you adjust? Oh, that's to me. Here.
Okay. So
All right.
Mark, can you stand in the front?
Sure. Here
And
we
the
go.
students can stand behind you. We'll follow him. Come on, let's practice.
It's not.
It's not every day you get a sifu in front of you to.
Oh,
Come on,
哪里
Grace.
我不是师傅，
Let's do it, all 3 of us. Stephanie, do you want to participate too? No?
我是徒弟而已。
Okay. You stand in the middle.
Okay.
And then you can correct us after
All
you
right.
show. We'll follow you.
So, we'll do Jianzhuang first because it's the easiest, right? We'll just do Jianzhuang. We'll do the Bagua one.
哦，你看不到。
So we're
坐在
here.
前面 Come to the front. 一个
So
举
we're
起
here, feet are together, right? This is just the Jianzhuang, right? Bend the knees, lift the left up, put it down under the shoulders, really easy. Shift over, just like in Tai Chi, right? Arms are going to come up in front, right over the knees, and sit. Round the back, extend out through the fingers. Feel the fingers stretch. Relax the elbows down, relax the shoulders down. Don't just let the wrist be dead. Extend them so that you have an empty space in here, right? Out through the fingers. Good job. And the head is up. You might find the chin tucks back a little bit. And you're here. And you're breathing down into your dantian, right? Into the belly.
So can you come and correct our position?
Sure. You
Shoot,
come-
Sam, can you shoot us? And then you guys at home too, look at your own position if you have a mirror.
Bring this in just a little closer. Bring this in. You don't have to go so far. Good. And come up a little higher for you. There you go. Relax here. Good. And feel this. Expand. There you go. A little better.
Oh, you have to be slouching a little bit.
Not really slouching, but more like, watch, put your hand on my back. You'll feel. See how I expand? It
Oh,
kind
the
of looks like I'm
shoulder-
slouching. Now
The
watch
shoulder
this.
blades are coming.
So this is something they
coming
normally
outward.
don't teach, but watch this. Grab my back. Grab like the skin on my back. Go ahead. Grab it with your finger. Now watch this. As I expand, See how it comes out?
Yeah.
So the idea is that you're expanding Taiyang, literally expanding Taiyang.
Your wife never can grab you.
Yeah, exactly. So when I go to grab Tina, she wants to expand this.
I already expanded.
Go ahead, expand. There you go. So the idea that she's expanding it, she's not really, you notice how it's
Can you
not a
see it?
slouch, right? It's
Yeah,
not really
yeah.
a slouch, you're expanding forward.
You're expanding the two scapulas
Yes,
outward.
and it expands the upper back,
And
and
the
eventually you want to feel it go all the way down the back to the mid back and the lower back, which is hard.
Okay.
So good, and that's
Okay.
relaxed. All right, let's see, Myra. All right, relax your shoulders, relax your elbows down. There we go. See how your fingertips are there? Not straight, rounded, but they have like a oomph to them. There you go, that's better. Good job. You can come in a little more. Come in only shoulder width. You don't have to, yep, and try to point your feet. For women, sometimes they're pointed out a little bit because of the hips, but in this case, her hips aren't that wide, so she can have
toes
them
have to
forward.
be pointing forward.
Pointing forward, so if their hips are very wide, they can have a, there you go, good. Relax.
How long
Let
should
this
we
sink a little
practice
bit.
this every day?
Start with 5 minutes, work yourself up to a half an hour. Relax, extending forward, better. And try to get this to extend. Watch this, put your hand on my upper back. Just flat, feel this? Feel that moves? Yeah, try to do that with your upper back. Relax this down. Good, better. Relax the elbows down. Good, good. That's better. Excellent. All right, Grace, you're up. All right. So she's gonna bring her legs in just a little bit. Oh, no, that's actually pretty good. All right, you're pretty good, Grace. Sitting down. Okay, now instead of sitting your hips forward like this, watch this. Sit back. There you go. Almost like you're about to sit down in a chair. Yeah, and then this relaxes down. This is here, relaxes. Now see your fingers are weak. Make them kind of, give them some, now see how your wrists are bent. Have them more a little curved. There you go. There you go. Almost like you're holding a big jar. You're the drunken master, right? Holding the big jar. Relax the shoulders down. Good. And allow this to kind of expand a little bit. Good job. And then this kind of pushes up through the neck. But tuck the chin just a little. There you go. There. See how this is? Here, come out a little bit. Good job.
Do you guys have any questions? Can you type into the chat room?
Type into the chat.
And
We'll
then
answer
Donna
those
will,
if you have any.
read it out to us.
Yeah. All right, good. That's good for starting. All right, we're going to do the second one. So you guys at home can practice this. Try to get the intention, that little bit of strength, not straight. See how she straightened it? We don't want it to be straight. Relaxed, relaxed. But we want it to be almost like rubber, like it bounces off of a little bit, right? It gives a little bit, but it's there, right? I have this little press back, almost like if you punch the tire. The tire's not stiff, but it bounces, right? Because that's kind of the idea. So that's it. Good. All right, the second one. This one's a little tougher. So this is the Chensan Lian, the 3 heaven linking. So start here. We're going to lift our left arm.
Bend forward.
Bend-
so is
bend
the
your
knee
knees.
over the toes or no?
About that, yeah. It's just, this is a transition. So it's
Okay.
about over the toes. Arm comes up, other arm comes over.
Breathe in.
Breathe in and exhale. Push through. Now, this foot is going to step forward and around. Now, notice I don't want my foot to be across because then I'm off balance. So it comes out, but look, if I draw my foot straight back, notice it doesn't cross my other foot, right? I just allow my knee to tuck in, which is why it looks like it does, right? So now look, now I can turn my hips, and my groin's not open, which is why a lot of people think my foot's like this, but it's not. It's actually here, right? So I go here.
So around 1 o'clock is where your foot
Around
is.
1 o'clock, yeah. So I'm going to
12
bend
to
my
1.
foot. Yes. This is going to come up, and then exhale. Now I'm going to turn. This is going to rub under the other arm as it overturns. Yep, good job. And I'm going to sit.
Wow.
This one's a lot tougher.
This one is a lot tougher.
Yeah. So this is going to
I feel a
extend.
cramp coming on.
Yeah. So now this is up, and this presses out. Good job. Excellent.
So
That's
are
better.
you trying to turn as much as you
As
can?
much as you can, but not the hips. Watch
Yeah,
this. Put your
just
hand on
the
my belly.
upper.
Watch this. And put one hand on my hip. Watch this.
Yeah, I know. You're
this
just
hand
turning
won't
the
move.
upper body,
This upper
right?
hand will move. So that's the idea.
Like
Give that a
salsa.
shot. Yes. Yeah. Go ahead. Give it a shot.
And then forward.
Inhale.
The
Yep.
leg forward.
Yep.
Yeah.
On a turn. Inhale. Good job, Grace. Inhale. Now step forward.
Step forward. Step forward.
Now, yep.
And then turn just your upper body. See, you're turning your
And
whole.
yep. There you go. And then watch this. You're
Wow,
gonna
this is
turn.
hard.
turn,
Definitely
turn,
you should
turn,
try.
turn, turn, turn. And then
Straight?
press.
Camera?
Now bend the elbow. Press.
Okay. So
through.
shoot them straight, yeah.
Uh-huh. Good. Good. Better. Here. It's a good start. Press through. Try to pull this up. Relax. Put some power in your fingers. There you go. This one's a little harder,
Yeah.
right? On the legs? All right. Good. Good. So notice how your hips is like
You guys
turn.
just
Watch this.
try
Notice my
stand
hip
up.
stays straight.
Just move the upper
You're
body.
doing this. Watch me. I just turn the upper body.
对，它只是
There you
分
go.
解了。
Little more
Oh,
difficult,
better.
right? Yeah. So, but it's more stable. Watch press. Watch. Do the other way you were doing it, where you twist. Feel you're off balance more now. So that's the idea that you're building that. All right. Let's give it a shot.
So the whole body.
And turn over. And here. Good. Press out. Relax down. Yep. Bent. Bent. Remember, elbows hang a little bit. Yep. And here. Press through. Good. And this is here. Good. Not bad. All right. Relax, but press. Yeah, you're pretty good. Does she secretly practice at home? Did she-
Secretly, yeah.
Secretly.
Last night.
Last night. so yeah, good job. All right, so you guys get an idea. If there are any questions, throw them up in the chat box. I know it might seem a lot
Any
right
questions?
now, but we'll answer those.
Let me give you the microphone. Hold on.
So the idea here, and you can feel this, and I can come up and do more, presentation if.
question.
Oh, so you have a question? Go ahead. Is there any? I don't think
Yeah.
there are. Oh,
It's
there
in the
are?
Chat room. What are you focusing on in the static pose for half an hour?
What am I focusing on in the static pose for a half an hour? So when you're here, if you're just in Janzhuang, relaxing, sinking down into through your feet are gripping the ground. Collarbone comes up, head is pressed up, shoulders are relaxed, elbows are relaxed, wrists are extended but relaxed through the fingers, right? And then I'm breathing into my abdomen. So you can breathe in your mouth, or in your nose, and out your mouth, or in your nose and out your nose. The tongue must be at the roof of your mouth, right? Now, you can do many postures. You can be here, you can be here, 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 whatever you want. This will be really tough, right? You can be here. There's a lot of different postures. You can look up online under Yiquan, Y-I-Q-U-A-N, right? They'll have a lot. Or Bagua Ding Shi, B-A-G-U-A, D-I-N-G, Shi, S-H-I, right? Or you can look up Xingyi, the ideas in here, the Santi Shi. You'll see variations that they have for standing. Also, there are other systems in Kung Fu that do this. Dai Xin Yi and these other systems also have standing postures. They're not easy, but they cultivate qi and power, right? So you're keeping this pressed out to the fingers, you're relaxing down, head is up, breathing into the abdomen. Some cases, some people breathe into the chest for certain things, but in general, we want you to breathe into the abdomen to build the abdomen. This is the center. You're going to issue, this is like the transit point from the legs up to the upper body. It's got to pass through here, right? Dai Mai, Ming Men, Dan Tian. So you want to build this. As you relax your back down, you'll realize you'll stretch out Ming Men. You're going to stretch out your lumbar fascia. It helps with back pain too. If you're bending all day, sweating because I've been doing this. You're bending all day over the table, doing this. You want to be upright. You want to have better posture, right? So it's going to strengthen you to have better posture, right? That's going to be one thing. The other thing with Bagua, same thing. If you're here and you stand up and you come through and then you come across and overturn. Some people breathe into the abdomen. In this posture, I tend to breathe into the chest. Bagua does a lot of like chest breathing where they empty down into the abdomen. So you're here. Breathe here. When I exhale, the pressure from my chest, the chi in my chest, moves down to the abdomen. So you see? I'm pressing out. My fingers aren't here. My fingers are pressing out, right? If they're here, they're pressing out, right? Later on, I'll teach a method. It's not clean needle technique, but it's a technique I learned in China of actually using this hand posture for free needling. I learned this from my Shifu, Shu Lao Shi, or Shu Shifu. He taught me how to do this with he kind of developed it from the piercing they use in Bagua into a needle technique that they use in acupuncture. So it was kind of cool. And we'll go over this later on. So those are some ideas. Any other questions, Donna?
Is there a best time to do this exercise?
I find for me, in the morning, definitely before you're going to be in the clinic. And then in the afternoon or the evening, after you're all done, just to let everything go.
You have to, right?
Yeah, it's
All
really
the-
nice. And here's another thing. Some of you guys might get sick from seeing so many people. I used to see a lot of people. How come I didn't get sick that much? Because I was constantly discharging. I wasn't allowing, when you're needling people, when you're touching people, and you're doing massage or qigong or therapy or acupuncture, it's not like herbal medicine. Herbal medicine, you can have them on the other side of the desk and you can write the prescription and, okay, get the hell out of my office, on and on. But acupuncture, you have to touch them, right? So these things can get on you. And I don't just mean like, oh, qi gets on you, but also pathogens. Like somebody comes into your office and has COVID. They don't know it, right? You need a way to discharge this. And as you're doing this, it's releasing Taiyang. You feel your sweat immediately when you start to do it. You're releasing Taiyang, you're moving these fluids, and by doing it correctly, you're actually going through the motions of releasing the exterior and helping to harmonize, if you're doing it correctly, the interior. So it's gonna help to clear these things out of you, whether they be physical or energetic, right? So this is a great thing to do, so. Any other
this
questions,
help?
Donna?
Yes. Does this help if posture is already poor with rounded back?
Does it help what?
Does this help if someone's posture is already poor and they have a rounded back?
So the thing with these postures is that while it can help with the rounded back, you might want to adjust it. So if their back is really slouched and rounded, you want to have them extend their neck and focus less on the rounding of the back and more on the extending of the neck. There are what they call yin and yang postures. So this is more of a yin state, right? I'm sinking in, all my yang channels in the front are coming in, right? This is more yin, right? So it's yin. Then the idea of yang would be the idea of doing it the opposite way. And this isn't taught as much because most people have this as a problem. Most people are like this, right? They walk around, they're really like this. Some people are like this, right? But a lot of people, when they're up, they're pushing this forward. So we have them relax, we have them open, we have them do this. However, there's a yang version to this. So if you're doing Zhanzhuang and you're here, you can also do Zhanzhuang, roll your shoulders forward and come here. Notice this one, my knees are here. As I come forward, my knees go out more and I roll. So it would look like this. And I'm rolling back. Now this isn't something you're gonna see. Notice my butt pushes out. I'm rolling my arms back. So this would slowly over time. Oh, okay. Hold on real quick. That's good. So this would slowly over time take somebody with a rounded poor posture forwards and push them backwards, right? Because it gives them that. Generally, we don't teach that in martial arts because most people have the problem of having everything too high and up, right? It's not so much this, right? Now, today we do because we're all at desks, right? And we're all slumped over. So the idea of practicing Zhanzhuang like this with somebody with really bad posture where they roll the shoulders back and they bring the chest out and they push the butt back. It's the exact opposite posture. This is a yang version. This could be taught for that person, right? The shoulders are still relaxed backwards. The elbows are still here. So there's this, which is the common Zhanzhuang you see, right? And there's this, which is the yang version to counter that with people who have really, really bad posture. Those are there and they're taught. Generally, they're not taught, though, off the bat to most people when you study this stuff because most people don't have the power and the correct posture anyways to do this. So they have them do this first. And only after you've been around for years, if the teacher understands the idea of yang postures, then they might teach you that as a thing to practice. We do that in Bagua. We have yin and yang postures where you might be like, for example, trying to think, where you're here. So this is the same idea in Bagua where you're here, and you're, instead of this, you're here and you're turning, right? So they'll walk a circle, they'll be here, right? But then there's a yang posture, which is here, it's closer, right? And the same thing, if you watch me, I'm here. Notice this one's here, like we discussed, and now I roll this back, I'm here, right? I'm in close, right? So there's a yang posture, yin posture. Most people never learn yang postures. They only learn the yin postures because it's something that the teacher is trying to automatically correct the tightness in the upper back and to create power, so they do this. But over time, as you get good at that, learning the other thing martially is for being up close to somebody, right? I can come here and then attack them. But the other idea for somebody who's rolled forward, you can teach them the yang postures to pull themselves up and roll them back. So that's an idea there. But again, for the shoulders, if they have shoulders, get them to do shoulder rotations. An excellent way to open up the shoulders is this. Hands here. Imagine like there is a bar that comes straight out from the wall, right? And you want your shoulders to go over it. here, my shoulders go over, around the bar. So like if Tina, here, come here real quick. If this is the bar and she puts her arm out, I want my elbows, you just straight out like this. I want my elbow to go around. Around. I want to get it up, right? And I'm really stretching back and down. And then I pull forward and in. See, my back is here. And then I'm coming up, 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 and around. This is going to help to fix that posture, right? It's also going to help you as an acupuncturist open up the idea of Da Jue, Do 14, Taiyang. And then you're going to be doing this, and then you're going to be going the other way, right? Rolling forward and rolling down. See, I'm rolling down. Rolling forward, rolling down. Rolling forward, rolling down. So this is going to help to open up those shoulders, open up that back for you as an acupuncturist, but also for your patients to help them if they have bad posture. Is there another question?
If a patient has cancer, can they do this to increase their immune system?
Yes, these are excellent. In fact, Zhanzhuang and different types of Qigong are used to treat oftentimes what they consider incurable diseases. So a lot of times, if there are major, major issues, over time, if taught breathing correctly, if taught standing correctly, if taught the principles correctly, Zhanzhuang can affect your physiology in a very positive way, not only just building energy, but affecting those pathophysiological mechanisms that are oftentimes leading. It's not just, don't think it's just a posture thing. Zhanzhuang builds the kidneys, right? So it's going to affect your qi, right? As you're breathing over time in the beginning, inhaling in the nose, exhaling out the mouth, you're clearing heat. You're clearing heat. And then, over time, as you clear more and more heat, what happens? You reduce internal inflammation. You're going to reduce those acidic environments, most likely if you're altering your diet. That will also help to correct cancer, you know, in conjunction with whatever other therapies, Western or otherwise, you're using. So this can be an aspect to your care, not just for giving you energy, but also to affect the overall environment of the body. And standing is something that's oftentimes used for people, and Qigong and breathwork is used heavily for people with irretractable diseases. Patients you have a lot of trouble with, if you can get them to do this, you'll find your treatments will always go way beyond. Any other questions?
Any pointers for beneficial forms of Qigong for pregnancy or labor prep?
Breathing, doing abdominal breathing is good, but also chest breathing. Learning to, when you're doing this, long, slow breaths are very good. Abdominal massage when you're done with your breathing. So what you do is you start at Ren Hai, right? Qi Hai, Ren 6, and you come around and up and down, and you're lightly pressing up and down. And you might do this 25 or 30 or 50. If you're preparing, if you got time and you're just at home, do it 100 times one way, and then come the other way. Relaxing and moving, right? It's going to allow the baby to move in the womb. One of the things that I see a lot of out of pregnancy cases when I see them, a lot of it is babies turn the wrong way. And I just had one recently. It was in June. The woman came to me. She was 9 months pregnant and she was overdue and the baby was facing the wrong way. And she said she had just been to the hospital and they had 4 people trying to turn this baby and they couldn't turn the baby. She comes to the clinic and simply through, because again, the power in the hands, I just took the baby and turned it. We moxied the end of the bladder. Yep, yes. Bladder 67, right? The baby toe turns the baby, yes, right? And then I just took my hands and I had somebody there at the clinic with me, and they were watching me for the day, and they were freaking out watching this because you had this huge pregnant woman, and you're watching her belly, and the woman who was assisting me that day was like, "Oh my God, is that painful?" Mind you, she was 28. She had never, had a baby yet. And the woman's like, "No, it's so comfortable." They had 4 people at the hospital trying to turn this, and 4 of them couldn't do what I was doing myself. And she said it was super painful because they were pressing down. She's like, "Oh, you're taking all the pressure off my spine," because we were slowly moving the baby around and around. Then she went back to the hospital, and they ended up moving the baby the last little bit, all because we loosened everything up, right? So these things are very, very good. So the massage, right? One way. And press. It's not just light. You're pressing, right? You're pressing in, and then you're pressing the other way. You can go 100 times one way, 100 times the other way at the end of your breathing sessions and feel that. Be with that. Keep that intention there. Feel not just the intention, but you're pressing, and you want to pay attention to the movement and how it feels. Allow it to relax everything, right? All right. Anything else? No? Okay. Let's do it. All right. So we get through the Qigong. I think we're going to do the first demonstration here. Oh, we got a lot of questions. All right. All right, let's go through this. John Zhuang. All right, here we go. Hi. We're gonna do a break real quick. We'll be right back soon. 10 minutes. All right, 10 minutes.
Let's take a 10-minute break and
How
we'll
do I stop?
return.